What's something that like you hope a new technology will come out to fix it, I guess, or help you with a certain procedure or problem?
One thing that we deal I don't know about technology, but one thing that we deal with a lot is toenail fungus, unfortunately. And there still isn't something that's 100% that works great for patients. So having something that would help patients for that would be wonderful.
That's I does not sound pleasant at all. Is it like topical thing that you give them or
Topicals, there's an oral medication, but there's still nothing that's 100%. And the oral medications come along with some side effects. And the topical medications only work a certain amount. So there's nothing that is really steadfast.
yeah, I mean, there's always those problems in very specialties. Like, I guess headache is the first thing that comes to mind. It's not really anything that's pointed. It's just kind of generalized treatment for a lot of people.
That's right. Yeah.
Do you think that podiatry, you can tailor your treatment for most people, or just it's like kind of the same thing for most people?
No, I think you can definitely tailor it. I think things are very different from patient to patient, and even the same pathology is different from patient to patient. How you treat them, what the best treatment is for them. There's a lot of aspects that you want to take into consideration.
Is that something that drew you toward like the sports medicine kind of podiatry route?
Absolutely. I mean, again, it's something that I enjoy helping patients. It makes me feel great when patients come in with pain and they leave without, or they are having problems and things now improve and they're able to do things that they weren't able to do before. So that's a really great feeling.
Yeah, and you talked about how cardiology kind of you steered away from that. Was part of it just like the, I guess, kind of the chronic nature of it that you have to always follow somebody's like condition versus podiatry? You can get them in and out feeling a lot better in a 1 or 2 visits.
It was more so, for example, I had a patient who passed away on me because they had cardiac issues. And so I took that very hard. So it was something that I just didn't want. I knew that my personality, I would take it too, it would bother me too much and it just wouldn't work out for me.
I've talked about this in other interviews, but like the outcomes of patients is something super important that not a lot of people think about, because they're like, oh, I want to do neurosurgery or I want to do open heart surgery, but they don't realize that a lot of the patients that go through that are very, very sick and they don't always make it out of the OR. So
That's correct. Absolutely.
what kind of medical student or person is really drawn to podiatry? Maybe they're not really sure like what specialty they want to go into. How do they know that podiatry is right for them?
I think somebody who likes orthopedics, I mean, again, podiatry has many aspects of it as far as medicine goes. It has dermatology, has orthopedics, it has, again, biomechanics. So I think it's somebody who fits into those types of realms and again, they enjoy it, they like it, and it works out for them.
So would you say that someone who's kind of like likes to be a jack of all trades but a master of none, kind of it would be drawn towards it, or because of like the specialized kind of nature with one body part, they maybe should look in a different direction?
I mean, again, I think there's many ways to do it. You could be a jack of all trades and not be specified to one thing. And I'm always of the consideration you want to be good at the things that you do. So I think that if people are looking at specific things that they want to do, right now, medicine subspecialties are a very big thing. People really having a niche as far as what they do. So I think it just depends on what they look towards from a treatment standpoint that works for them.